Welcome. My name is Deirdre Dixon Gilbert, your host of Malpractice Diaries, MD, the secrets they keep.
Isabel Palmer was an 85-year-old woman who used to golf in the summertime and curl in the winter, an active lifestyle. And so when she developed a severe and sudden abdominal pain back in January of 2015, she immediately went to see her doctor. That doctor was Dr. Mark Kazimirski, and he diagnosed her with an abdominal blockage or constipation. It turned out it wasn't constipation, it was cancer. Now, the procedure and the treatment continued. He prescribed a series of laxatives, enemas, as well as IV fluids. It continued on that treatment for a number of days. Her condition got worse. Her pain became more severe as well. She was eventually transferred to doctors here in Halifax, different doctors who took a look at her and were shocked by what they found. Here is Dale Palmer, Isabel's son, to explain.
I only subsequently found out that she almost died in the ambulance on the way from Windsor to Halifax. Very quickly, the doctors told us that they didn't have time to spare. She had an hour to live. In fact, described her as the sickest woman in Nova Scotia at that time.
So what followed was months of chemotherapy. Eventually surgeries removed her ovaries, her fallopian tubes, as well as much of her colon. She survived that bout with cancer and filed a complaint against the doctor with the College of Physicians and Surgeons. We now have the results of that complaint, and the report shows that the doctor, Dr. Kazimirski, should have provided more care, did not provide the adequate standard of care in this case. He's been reprimanded by the college and has been told that he needs to have additional training that's going to come out of his pocket to be paid for. As well, he'll be audited for 6 months when he does return to practice for his medical career. Overall, Palmer's family says that they agree with the results of this report following the complaint from Isabel. However, Isabel did not live long enough to see the results of this complaint. She once again developed cancer over the last number of years and passed away this past November before hearing the results of this report. Brett Ruskin, CBC News, Halifax.
Carla was active, worked out every day, very disciplined diet, avoided sugar, never smoked, and did not drink alcohol or drugs. One day, she complains of stomach, bloating, and pain. She goes to a health facility that diagnoses her with kidney or urinary infection, probably caused by lactose intolerance. She's given a prescription, but her pain and bloating gets worse. About a month later, Carla was diagnosed with possible uterine cancer. Her diagnosis went from uterine cancer to constipation. Was Carla misdiagnosed? Did Carla truly have cancer in the beginning, or was her problems created by chemo and radiation? These are some of the questions we don't know. Death by laxatives or cancer misdiagnosis.
Medical malpractice is the third leading cause of death in America, but is a well-kept secret. The truth has been hidden for decades, and the medical community would have you believe that there are nothing but frivolous lawsuits destroying their world. There is no such thing as a frivolous lawsuit, but that's the fabricated story being told. 1.5 million people die from medical malpractice a year, and that's a secret. Thousands of medical malpractice suits hidden in a database, botched surgeries, wrong site surgeries, instruments left in bodies, drug and alcohol issues, falsified medical records are all kept secret. Tort reform is what is called, but it has been the secret ingredient to no accountability. Malpractice Diaries, MD, we tell the secrets they keep. No more silence. www.nmmaa.org. Sponsored by the National Medical Malpractice Advocacy Association.
Let's welcome Wade to the show.
Thank you, Deirdre.
You're welcome. So let's go ahead and get into the show. I know that I sent over a question and it said that Carla was healthy. She went to the health facility, diagnosed with infection. Can you give me a little bit more about that day?
Yeah, in late September, she was having pain. We were in Utah visiting my sister and her family. We went to a clinic, and the clinic diagnosed, uh, you know, a kidney or urinary infection, and also lactosis that was causing the pain and everything. So they gave her some meds for the infection and recommended that she, stayed away from any dairy products. Carla did eat a lot of yogurt. She ate very healthy all the time and stuff, so she did eat a lot of yogurt.
Okay. All right. So I see that you said you're not exactly sure or you don't really remember, but do you know whether they did any testing on that particular day?
Not on that particular day. I know they took urine. I think they took blood. Um, they, kind of did a physical examination, so to speak, and but it was with a physician's assistant, not a doctor per se, and so that's kind of where we were at.
And I'm going to go to some of the other questions here. I noticed that it said that you were actually traveling to Mexico for work, right?
Right. Well, that was towards the end of October.
Okay.
Uh,
Okay.
my wife was Brazilian. I work in Latin America. I'm talking to you from Mexico right now, as a matter of fact. So, but yeah, I was working in Mexico. Carla was visiting her brother in Orlando, Florida, and she was having bad pains. So they never really did stop. She was having bad pains. So we took her, or she went into a clinic there, and they kind of recognized that it might be cancer and sent her to the main hospital, where they gave her morphine and everything to help her with her pain, and drained fluid from her. Uh, the sac. I'm sorry, I can't remember what it's called, but they drained fluid from that, and the fluid was cancerous. So they told us that, I got in there that same day, and they told us that they were going to do a hysterectomy to remove the cancer.
Okay. So you go into a hospital, and I'm a little confused at this area. So did they actually do any sort of testing to diagnose her at that moment? To
CT scans, blood tests. They took a biopsy. Uh, so yeah, they did, find a tumor and everything at that point.
Okay. Now I notice here it said that they advised you that they needed to do surgery and that they
Right.
removed part of the colon. I'm looking around October the 31st, and this was about
Right. Uh-huh. And
2018.
she had to have a colostomy bag, correct?
Okay. After the surgery, and this is where I'm a little confused with the doctor because it said she thought that she had gotten all of the visible cancer out and that she checked pretty much her lymph nodes. This was like October 31st and didn't see anything.
They told us they didn't see anything at that point.
Okay. However, I'm looking at what you wrote on November the 1st, and you stated that the doctor claimed, or the doctor said that she had sent a sample of the tumor for pathology. However, did you know that she had a tumor at that time, or did they tell you that she had a tumor or no?
Yes, they did.
They did. Okay.
But and that's like I say, they said they got it all out when they did the hysterectomy. They said there was nothing in the lymph nodes. They said it had kind of attached to her colon, so that's why her intestines. So that's why she had to have the colonoscopy.
Okay.
at that time. So they said they could have probably fixed it so she didn't have to have the colonoscopy, but they said, with chemo that they were going to do, it'd be better just to do the colonoscopy and go back in afterwards and remove it.
Did she have any cancer in the family? Because according to
Zero cancer in the family.
Mhm.
Nothing like that.
Okay, so they just diagnosed her and said she had cancer. Immediately decided that they were going to just do a hysterectomy. And after having the hysterectomy, she went into treatment.
Yeah, about 3 or 4 weeks after she needed to recover from her hysterectomy. She recovered very well. She started chemo treatment, and it didn't bother her at all. She started working out again with the doctor's permission and everything. She was working out. She didn't have to take any of the nausea medication or anything. So yeah, they started up the chemo about 3 or 4 weeks after the hysterectomy. I got it in a time report and everything. But one thing, it was delayed a little bit because we were self-paid at the time. So my wife was Brazilian and she had her own insurance in Brazil, but we found out it wouldn't cover her in the U.S.
So go ahead and explain to the audience when you say self-pay. What was the problem with that?
I was out of the country. I guess, with the type of insurance she had in Brazil, you had to, do something special so that the insurance would cover her when she was traveling. We didn't realize that, so.
Okay. All right. So after the surgery, we talked about that. You said they did find a tumor. Uh, I'm wondering here. You said that they told you that she had this tumor. You all decided, okay, we're going to do this hysterectomy, and you started chemo. And she's doing fine with the chemo treatments. What is it in here that causes this person, to decide, or this doctor to decide that now, was the chemo not helping?
They told us originally that it was only going to be chemo and that they'd only do radiation if they saw something. So halfway through, after three, they're going to do 6 cycles of chemo every 3 weeks. Halfway through the chemo, they told us they're going to stop the chemo for a while and do radiation. And we asked them if they saw anything. Obviously, we were really worried, and they said, no, that was a plan all along. And when I tried to ask them, well, you told us, that it was only going to be chemo, they were really aggressive, argumentative, and it would stress Carla if I argued with them. So I just left it alone, and we went to the start of the radiation treatment. But January 22nd, she had CT scans done, chest and abdomen, and she was clean from cancer still as of January 22nd. And then they started the chemo. And a couple weeks after they started the chemo, she started having pain in her lower back. And she had a stent in her lower back from the original hysterectomy. They put a stent in there. So, we were, and the pain kept getting worse. So we were, trying to tell anybody who'd listen, and they just kind of kept acting like she was overreacting to the stent. And after a while, it even got to the point where they made us feel like she was just trying to get the pain pill, type of thing. And that wasn't Carla at all, type thing. I had to convince her sometimes to take the pain pills. So this goes on and on and on. And her last radiation treatment was April 18th, and they did a CT scan April 18th, told her she was cancer clean. We go into ER on April 20th, and she's having really bad pain, so I brought her into ER April 20th, and shipped her to the main hospital under the care of her oncologist, and basically they just treated her for constipation. And then the same thing a week later, we went in again, April 27th, to ER. Treated her for constipation, about 3 days, and released her. And after she died, I found out reading the reports that the ER doctors on April 20th diagnosed that she had a tumor. And then on April 27th, they diagnosed she had a tumor, a collapsed lung, and fluid in her lungs. And they never treated her for any of that kind of stuff. They never told us any of that kind of stuff was happening. And finally, May 15th, she was supposed to start chemo again. And she's in the chair to start getting chemo, and she's in really bad pain. So, we're assuming, like they are saying, it's the stent. So we called the urologist and said, hey, she's real bad. So he says, bring her into the ER and he'll order some CT scans. So, we do that. Then, her urologist tells us, yeah, she's got a football-sized tumor, And that tumor developed while she was seeing a radiation oncologist 5 days a week, seeing her other oncologist a few times, the urologist, and 2 ER trips, and a football-sized tumor forms, and nobody has a clue, I talked to the radiation oncologist a little bit, and he said, yeah, we only did a partial CT scan, and only in the area that we did the radiation. And it's like, well, that didn't do any good. She had a football-sized tumor. How could you miss that? How could that happen?
Exactly. So we know there was an office worker that whistle blew about patients that were being given chemotherapy when patients actually did not even have cancer. And one of the questions, and I know that we've investigated these types of behaviors before on doctors diagnosing patients with cancer that possibly didn't have cancer. And basically, I'm wondering, and I'm asking the question, do you think that what happened to Carla could have been based on the treatments of the chemo or the radiation?
My personal opinion, Deirdre, is, I've done a lot of research. I'm sure you probably have too, and both chemo and radiation can cause cancer. It's been known to cause, different cancer later on from somebody that's had it. My suspicion is that maybe the radiation treatment instigate or started up the cancer again. I don't know for sure. I don't doubt that they that she had cancer. I question the diagnosis. They said it was stage 4, but if it was stage 4, it's supposed to spread to the lymph nodes and everything, and they said it didn't do that. And then and also after what I saw from all the other things, it's like I question whether they gave her the right chemo. Why was the radiation aimed in the wrong place? Why wouldn't they listen to her? But no, I don't believe that there was any purpose misdiagnosis.
Let's look at this video. We'll be right back.
A Michigan office manager risked his career to expose a doctor who gave chemotherapy to patients who did not have cancer. Dr. Fareed Fatah gave unnecessary treatments to more than 500 patients at a Detroit area cancer center. In tonight's episode of the CBS News series Whistleblower, host Alex Ferrer talks to the former office manager who stepped forward to expose the man responsible for this.
I couldn't believe what was in front of me. I couldn't believe what I was seeing.
George Karache took a new job in 2011.
I was an office manager for an oncology practice.
Dr. Fareed Fata had a rapidly expanding practice in suburban Detroit. But within 2 years, one of the other oncologists and 2 nurse practitioners announced they were leaving. Karache confronted that other oncologist.
Are you leaving? And he said, yes. And I said, can I ask you why?
What the doctor told George Karache about Dr. Fata was a bombshell.
Patients were given chemotherapy and other treatments when they didn't have cancer.
Robert Sobere was referred to Dr. Fata by his back surgeon.
I heard he was one of the best there is.
I am Dr. Fareed Fata with Michigan Hematology Oncology.
Dr. Fata did a bone marrow biopsy.
2 weeks later, he turned around and said, you got multiple myeloma. It's a blood cancer, a bone-destroying disease.
He began monthly chemotherapy infusions.
I'd become weak, sick to my stomach, tired all the time. I couldn't walk anymore. The chemotherapy eventually destroyed all my teeth.
Sobere went to see a different oncologist. He was shaken by what he heard.
And he says, I've seen both biopsies. There's nothing that says that you had cancer anywhere in there. I was shocked. It was worse than hearing that you have cancer.
I was determined to have this doctor stop harming people.
His head spinning, George contacted an attorney he knew who handled whistleblower cases. George believed he might have a strong one.
We've heard a lot of strange stories about fraud, but that one was beyond fraud. It was cruel, it was criminal, it was risking people with poison.
David Herron wasted no time. He called the Department of Justice.
Without a doubt, this is the fastest and most intense lawsuit I've ever handled in this area.
George Karache was willing to put everything on the line.
My job was at stake, my livelihood, even my own personal safety. I wasn't looking at the patients anymore as being treated. I looked at it as a burning building with people inside. I had to make it stop, and I had to make it stop quickly.
Boy, thank you, Mr. Karache. Alex Ferreira joins us now at the table. Good morning to you, Alex.
Oh, good morning, Gail. How are you?
I'm pretty good, but kind of despicable behavior. How could he get away with this for so long without anybody knowing?
Well, you know, in private practice, doctors have little to no oversight. There's nobody there to really check what they're doing, and he would provide the chemotherapy in his office, so there was even less likelihood of getting caught. On the rare occasion that he did go to a hospital, it was before 6 a.m. or after 11 p.m. so that nobody would be questioning his medical decisions. It was the perfect fraud, and as a result, over a very short period of time, he subjected over 550 patients to unnecessary treatment.
Why? Just money? Why?
Greed. Just total unadulterated greed. Using their body, their lives to pocket a few $1,000s in every treatment. It's incredible.
I hear that attorney, you categorize it as, you know, he's seen a lot of bad schemes out there. This is the lowest of the low.
Well, I've been a police officer, I've been an attorney, I've been a judge, I've seen just about everything, and this still blows my mind.
Yeah. Oh,
that he would do it himself in his office, poison him, and then watch it happen.
Yes.
Yeah, despicable really applies.
It's an amazing episode.
Thank you, Alex Ferrer. But you only do amazing episodes.
That's all we do.
There you go. Whistleblower airs tonight at 8 p.m., 7 Central, right here on CBS.
Okay, so it seemed that there were many conflicting stories or diagnoses. And in May, and I'm just going sort of based on what you sort of said, and I just looked it over briefly, and I saw some things. And in May, there was another surgeon that you said you did not even know to call her for surgery again and put a tube in the wrong side.
Yeah, they were, she needed to, she was having fluid in the lungs. She needed to have a tube put in her lungs and she was supposed to go in, and I can't remember off the top of my head what day it was, but she was supposed to go in one day and have a tube put in her right lung. Well, the lung doctor that was supposedly in charge of her, somebody else we'd never met, he wouldn't answer his pager, so she missed her window to get in to put the tube in that day. So they had to drain her lungs with a needle. And because she was getting really bad. Her pulse rate was in like the 140s all night, trying to, produce enough oxygen for herself, with all that fluid. So they finally drained it with a needle, and they told us, okay, the next morning they were going to put a tube in the left lung, that they had to wait a couple of days to put one in the right lung because it'd be too dangerous. Okay, I mean, we don't question really too much,
Right.
And so the next morning we go in, and she's in the pre-op, and the doctor who's going to do the operation, he comes up to me and asks me, which lung did they drain? I'm like, well, you really need to know that. Why are you asking me? And I said, I think it was the right lung that they drained, but you need to make sure, And he said, yeah, we'll check it out, no problem. Anyway, she comes out after the procedure, and the tube is in the right lung, and she never recovered after that. Everything went from really bad to worse.
And at the end, I know that, like you said, she did succumb and she didn't make it. Were you able to sue for this negligence?
No, I talked to many lawyers, including, Bradley Schwartz and everything. And the problem, it's like what, I've seen various people on your show and everything, it's really problematic today to try and sue, you got to be able to prove that what happened was the cause of death. At that, wouldn't have mattered if, it doesn't matter how much they hurt her. It doesn't matter if it was a few days before or a month before or whatever. A doctor's got to prove that had they did something different, there would have been a different outcome. And trying to find a doctor to testify against that's going to cost almost as much as the maximum amount of money you can get in a lawsuit. So a lawyer would have to do it they'd have to do it pro bono or free for to try and do something. And then from what I understand, talking with all the different lawyers, it's because of the way people think that there's so many frivolous lawsuits out there that it's really hard to win. It's like the lawyer talked about on your original show, and Bradley talked about, when he was on, and Michelle and everybody, and I'm surprised how many people I'm seeing on Facebook running into the same walls. The hospital completely shuts communication off with you.
Absolutely. Well, Bradley, I want to just say thank you so much. I know that this is very difficult for you, having to relive this, but thank you for sharing your story with us again. And thank you. And we'll see how we can help to change things.
And that's my main focus right now. We didn't have any children. It's just me. So that's my life's goal, is to, we've got some serious problems now that I've unfortunately become a part of it. And I hope that through people like you and through Michelle and everybody, that sooner or later we can, beat the drum loud enough that we're heard,
Thank you. All right. Thank you.
Okay. Each year in the U.S., approximately 12 million adults who seek outpatient medical care are misdiagnosed, according to a new study published in the journal BMJ Quality and Safety. This figure amounts to 1 out of 20 adult patients, and researchers say in half of those cases, the misdiagnosis has the potential to result in severe harm. Thanks for tuning in to Malpractice Diaries, MD. We tell the stories they keep. Please make sure that you tune in next week, same time, same station, same Facebook page, and subscribe to our YouTube channel. And we look forward to seeing you next week. See you soon.